strength of this test is that the athlete ensured that their hamstrings and lower back were both stretched and warmed up, which would have got the athlete the most reliable results. It's also very similar to the sit and reach test, so the client knew exactly what they were doing and what the test was trying to show. However, the main weakness for this test is that the scoring system is very, very vague, so it's hard to identify how good the client's score actually were when compared to other data. This is because you can either pass or you fail, so there's no in between. The assistant also didn't hold the client's knees straight during the test. This could have led them to being bent slightly, affecting the results. A final weakness is that the test is very similar to the sit and reach test, which was also performed. Now, this was a weakness because the athlete already knows what level they're at with their flexibility in the hamstrings and the lower back. So as the client received the highest score possible, there isn't much room for improvement, only a chance to maintain the level of flexibility within the hamstring muscles and lower back. So as I stated previously, when evaluating the sit and reach test, performing gentle hamstring stretches every couple of days or 3 times a week or 3 to 4 times due to the excellent score, when the client, for example, is to wake up, it's a very effective way of keeping the hamstrings loose. Before performing these low-intensity stretches, the client should make sure that they bend their knees, not during the stretch, but just before. This is, as stated by GMB Fitness, it will just take the slack off the calves and hamstring attachments to the knees. If the client was to let their hamstrings tighten up, then they would be at risk of also getting lower back pain as the two go hand in hand. These both will make the posture of the client worse and make movement very difficult and painful.